Hi, I'm Natasha Guthrie, and I'm going to be demonstrating some sensory motor techniques on my volunteer, Kelly Williams. Okay, and to get started, we're just going to talk about if you have a patient with a hypertense oral mechanism. We're just going to apply some firm, deep pressure on these points, pressure points around the lips. Just move around, applying pressure, trying to get those to relax. And you can also incorporate a little bit of stretching and massaging. And if the person should have a hypertonic mechanism, then you would use a tapping approach rather than the pressure to try to get those muscles to fire. Okay? Looks good. Moving on, get this out of the ice. Okay, if we want our patient to purse lips, we're just going to move this ice finger around the lips smoothly a couple of times. Can you pucker for me? We're just going to do short strokes on the side. Okay, relax. And I'm going to go both directions. Make sure we cover all of these muscles. And pucker. Okay, and can you say ooh? Ooh. Can you say sue? Sue. Ooh. Ooh. Two. Two. Great. Okay. Now, if we want our patient to retract their lips, we're just going to move our ice finger again across the lips. 3 strokes. 1, 2, 3, and then we're going to do short inward strokes around the outside here. Okay, any smile? Looks good? Okay, let's do this one more time. 1, 2, 3. And smile. Good job. Let me set this back in here. Okay, to stimulate unilateral weakness, we're going to glide around the outside of the lips with our ice finger from the stronger to the weaker side. And then we'll have short, repeated strokes away from the affected side. Okay, so let's do that. Okay, there goes. Short strokes away from the affected side. Okay, and we can also go this way. And again, stimulate these muscles away from the affected side. Okay, how's that feel?
Feels good.
Okay, smile for me. Say
E.
Me.
Me.
Good. Okay, let me switch tools here. Now I want to stimulate your fossil pillars. This is just to help with increased sensitivity to aid in bolus, swallowing bolus. And let me see, where did I put my tongue depressor? Oh, here it is. Sorry. Okay, just say and we're just going to show 5 strokes on each side of the fossil pillars. Okay, swallow.
It's cold.
Okay, and I'm going to do that one more time. 1, 2, 3, 4, 1. 1, 2, 3, 4, 5. Okay, swallow. Good job. Now, moving on, we're going to go to try to increase the palatal reflex triggering. And we're going to move from the weaker side to the stronger side. We're just going to do 1 stroke across the upper palate here in the back. Feel that?
Mm-hmm.
Cold sensation?
Mm-hmm.
Okay. Did you swallow?
Mm-hmm. Yeah.
Okay.
Maybe.
Okay. And then I'm going to repeat that one more time. Swallow? Okay. Okay. Now, a second technique to increase palatal reflux triggering. This time I'm going to use a frozen glycerin swab. And we're going to stimulate your weaker side first, moving to the strong side, and then the center. Okay. 1, 2, 3. Just lemony? Okay. Let's do this one more time. 1, 3. And swallow. Okay. Let's move on. We're going to move on to increased tongue-based retraction. We're going to start from the weaker side, moving to the strong side. Let me get a new glycerin swab here. Okay, get this one off to the side. Okay, and just stick out your tongue, and I'm just going to swab way back here across the base of the tongue all the time. Unless that swallow reflex, didn't it?
Yeah.
Okay.
Definitely.
Great, that's what we're looking for. And I just want to do that one more time.
Okay.
I can hear it.
It's gagging me a little bit too.
Okay, set that one down. Okay, and moving along, we have a second technique that we can use to increase tongue-based retraction. And I'm going to have to feel base here and the hyoid bone. I'm sorry, I can't speak. All right, I just want you to open up. I'm just going to move right down here. Yeah, I felt that. Did you feel the tongue-based retraction?
Yeah.
Yeah. Okay. And again. Yeah. That last one was a lot more of a retraction there.
Yeah.
Okay. And that looks good. All right. Okay. Now we're going to move on to the lingual curling response. So I just want you to stick out your tongue, and I'm just going to depress the tongue base here. And I'm just going to stroke down the center. See, the sides are curling up now. Looks good. Okay, and one more time. And those edges are curling up, so that looks good. Okay. All right, let me get another swab here. And now we're going to look at reducing the elevation in the posterior tongue. So we're going to do this just by starting at the sides of the tongue and moving in towards the midline. So you stick out your tongue. We're going to go 1, 2, 2, 3, 3, 4. You feel that sensation in there?
Yeah.
Okay, let's do this one more time. 1, 2, 2. That good? Okay. Okay, let's move along. We're going to go to elevating and elongating and elevating your tongue tip. So we're going to start at the lateral edges of the tongue from the posterior to anterior direction. And let's see, can you just stick out your tongue for me? We're going to go 1, 2, 2, 3, 3, and we're going to go 1, 2. Okay. Now, do you feel that curling at the tip there of your tongue?
Yeah, it was sour too.
Okay, let's do that one more time. 1, 2, 3, and up, up. Yeah, try to touch your teeth. Great. Looks good. And second technique for elongating and elevating the tip tongue. We're just going to go along the lateral edges of the tongue and then apply some pressure down towards the tip. Okay, so stick your tongue out. We're going to go 1, 2, 3, 4, 5, 6, tongue curl up. Okay, and let's do this one more time. 1, 2, 3, 4, and push. Good. That tongue curl up towards your teeth.
Yeah.
Okay. And then we have another technique just to elevate the tongue tip. Let me get my little stimulator out here. And this is going to be on the underside of your tongue. I'm just going to do long strokes. 1, 2, 3. And then right here. Push, push, push. Can you feel that? Not cold, more
yeah,
cold.
it is more cold on the underside,
Yeah.
for sure.
Okay. Ready? Put a little bit of pressure right there until it curls up. I think it's a lot more sensitive on the underside.
Yeah,
I feel it better. Okay, and we have one more, and that is to reduce the lingual deviation upon protrusion of the tongue. And you're going to do some rapid strokes. We're going to start on your weaker side. We're going to move to the stronger side. And then I'm going to have to do some cross strokes across the blade of your tongue that is away from the deviated side, yes. So we're going to start on this side. And then strokes away from the deviated side. And then pressure right here. Okay. And I'll do that one more time. And we'll go 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then the strokes across the blade. And then we'll go 1, 2, 3, 4. Feel good? Okay. All right, and that concludes the sensory motor techniques for today. Thank you.